Sleep apnea in children. Early treatment is critical. Obstruction in the airflow to the lungs and hence the oxygen supply to the brain, so there's a pause and breathing for a few seconds. Lots of episodes of sleep apnea could be happening during the nights during the child's sleep. So if it's happening a lot of times, that's a lot of oxygen deprivation to the brain and the brain cells function changes. Children who are not doing so well in schools and not able to pay attention may be disruptive in the classes. When you look at those children, then you often just see that they are mouth breathing. Parents can tell. Those kids are moving all around the bed while sleeping. They're tired in the morning. What are the early signs of sleep apnea in children that parents need to look for? Mouth open while sleeping. Teeth grinding. Recurrent infections. Chesty coughs. You may notice your child's bedwetting, or they might be waking up with nightmares quite regularly. That's another indication of brain getting disturbed because of the lack of oxygen. Should I be concerned if my child or somebody in my family snores? Snoring is an indicator that airflow may not be efficient to the lungs. Hence, oxygen supply to the brain isn't efficient. Brain cells are going to be affected. MRI scan shows areas in the brain are actually obliterated, and especially memory cells. Blue areas on brain map on left represent altered blood-brain barrier, as a result of obstructive sleep apnea. Yellow to red areas represent healthy blood-brain barrier. Brain without obstructive sleep apnea appear much healthier on right. ADHD hyperactivity. In fact, it may be not really a disease, but just more of a symptom of breathing disorders at nighttime. When there isn't efficient oxygen supply to the brain, it instructs cerebellum to get the heart rate going up, and the blood pressure will rise, and the adrenal glands will start producing more adrenaline. Brain uses around 20% of oxygen absorbed by lungs. Lack of oxygen to brain for 5 to 10 minutes leads to permanent brain damage. If treated early in children, sleep apnea can be completely cured by airway expansion.